Bismillahirrahmanirrahim. Today we are going to study diseases associated with purine degradation. One of them is gout. Gout, in cases of gout, the major complaints are as follows. Gout is mostly because of hyperuricemia, and it may have a comorbid problem which is called hypertension. अब यहाँ पे we are going to study about the complaints. So one of them is deposition of monosodium urate crystals in the joints, and that leads to gouty arthritis. And gouty arthritis develops because of an inflammatory response to those crystals. Neutrophils वहाँ पर collect हो जाते हैं in those areas, and they start fighting against the monosodium urate crystals. That's an inflammatory response, and this kind of an inflammatory response leads to the development of gouty arthritis. Next is nodular masses of monosodium urate crystals, also known as tophi. They may be deposited in the soft tissues, so that will lead to a chronic tophaceous gout. And the third one is the deposition of uric acid stones in the kidney, and that is called urolithiasis. So the patient will actually present with these kind of symptoms: gouty arthritis, chronic tophaceous gout, and urolithiasis. Moving forward to the diagnosis. The diagnosis can be done through a procedure that's called enterocentesis. For this, we'll have to do the aspiration and the examination of a synovial fluid from an affected joint using polarized light microscopy. You will see needle-shaped crystals under the microscope. Now, what can be the possible causes? Causes are multiple, but here I am going to discuss only two. One of them is uric acid under-excretion, and the other one is the uric acid overproduction. Uric acid under-excretion is a more common cause, often seen in 90% patients. It can be a primary under-excretion, means not secondary to any underlying abnormality, but it can also be secondary to some known disease that affects how kidney handles the urate crystals. For example, in lactic acidosis, lactate increases renal urate reabsorption. लैक्टेट की वजह से यूरेट की जो रीअब्जॉर्प्शन होती है वो इंक्रीज हो जाती है, लीडिंग टू अंडर एक्सक्रीशन. एंड इट कैन बी बिकॉज ऑफ सम एनवायरमेंटल फैक्टर्स, फॉर एग्जाम्पल द यूज ऑफ ड्रग्स लाइक thiazide diuretics or exposure to lead. Now let's move forward to uric acid overproduction. It can be because of some primary factors. Again, primary means not because of an underlying abnormality, and it can be because of some secondary causes. Because of some underlying abnormality. Now, primary can be idiopathic. We don't know why uric acid is produced in such abundance, but it can be because of mutations in the gene for X-linked PRPP synthetase. To understand PRPP synthetase, let's look at this reaction. Here, ribose 5-phosphate is being converted into 5-phosphoribosyl pyrophosphate, also known as PRPP, in the presence of enzyme PRPP synthetase. The activator of this enzyme is phosphate, and purine ribonucleotides, AMP or IMP, these are actually the inhibitors of this enzyme. Let's move back to that point. So they say mutations in the gene for X-linked PRPP synthetase, they will result in the enzyme having a maximum Vmax for the production of PRPP, lower Km for ribose 5-phosphate, which was the substrate for the reaction, or decreased sensitivity to purine nucleotides, which were its allosteric inhibitors. So अगर हमारे पास substrate जो है उसकी requirement कम हो जाएगी और PRPP synthetase जो है वो enzyme ज़्यादा abundance में produce होना शुरू हो जाएगा, तो PRPP की production increase हो जाएगी, which will lead to increased purine production. And the third cause is Lesch-Nyhan syndrome. As you already know, Lesch-Nyhan syndrome is also because of the congenital deficiency of AGPRT enzyme, and when AGPRT gets deficient, it leads to congenital overproduction of uric acid. As you can see here, Lesch-Nyhan syndrome, X-linked recessive, complete deficiency of AGPRT resulting in the inability to salvage hypoxanthine and guanine. Hence, they are degraded into insoluble uric acid. Now let's look at the secondary causes, which can be some underlying problem like myeloproliferative diseases, chemotherapy, or high rate of cell turnover. तो सेल टर्नओवर का क्या मतलब है कि जो सेल के अंदर देयर इज अ मेकिंग अ ब्रेकिंग अ प्रोसेस गोइंग ऑन, जिसमें क्या होगा कि जो डीएनए है दैट विल ब्रेक इनटू न्यूक्लियोटाइड्स एंड न्यूक्लियोसाइड्स, and it can be because of some unrelated metabolic diseases like von Gerke's disease or hereditary fructose intolerance. Uric acid levels also rise because of a diet that is rich in meat and fats, for example in seafood, or it may be because of the excess use of ethanol. What is the treatment for gout? First is anti-inflammatory agents to reduce inflammation like colchicine, prednisone, and indomethacin. And if patients are under excretors of uric acid, such patients should be given medications like probenecid and sulfenpyrazole. And if the patients are producing uric acid in abundance, like they are having overproduction of uric acid, in that case you'll use allopurinol. Allopurinol is a competitive inhibitor of xanthine oxidase enzyme. It is a structural analog of hypoxanthine. Allopurinol will comparatively compete with hypoxanthine and inhibit the formation of xanthine from hypoxanthine. And there is a non-purine inhibitor of xanthine oxidase, and that is febuxostat, that is also used in such patients.